And so let's do a emphasis on your Buergers and your Raynaud's disease. So when you see Buergers, this the involved part of the body would be your hands and your feet, while if you have Raynaud's phenomena, the involved part is your fingers and your toes. Okay, fingers and toes, fingers and your toes. So when it comes to the arteries, so the involved arteries in Buerger's disease is the medium arteries to small arteries. Your medium to small arteries, while with your Raynaud's, the involved arteries would be the smallest, the tiniest, the small arteries and your arterioles. The small arteries and arterioles. Okay. So what about your Buerger's disease and Raynaud's disease? So Buerger's disease, the main problem is that you have a inflammation. The cause here would be what happens to your blood vessels is there is a inflammation, while with regards to your Raynaud's, there is a presence of spasm. So that's why when you see Buerger's, the main cause of the problem would be just like your COPD. The main cause is smoking. So the main cause is smoking. Okay. Where is it? So the main cause is smoking. Okay, the main cause is smoking. So, and when you talk about your Raynaud's, the main cause would be autoimmune disorder. Okay, so you have your autoimmune disorders. So the most common autoimmune is your lupus. You have your rheumatoid arthritis, okay, and you have your scleroderma. So this is the most common. Okay, so again, for your Buerger's, it's smoking. Okay, this is a problem, or a problem for the middle-aged person. This is mostly the disease of the middle-aged person. This ranges from 20 years old to 40 years of age. So okay, so the what happens with your Buerger's disease and Raynaud's? So there is actually, the problem here is actually a loss of blood flow. Okay, the loss of blood flow on your hands and your fingers, okay, on your feet and your toes. So that's the main problem here. It's the loss of perfusion to the hands, feet Okay, fingers, and toes. So that's the main problem here. So our goal usually is to prevent this from happening. Okay, the natural goal would be prevent this from happening. So we want to prevent this from happening, because if we don't prevent that from happening, the ultimate problem would be or the end result would always go to a poor perfusion, ischemia occurs. Okay, there's already a ischemia occurs. There will be poor wound healing. Then you have gangrene. You have gangrene. Then eventually you have amputation. So that's the worst thing that can happen to your patient, what we call loss of limb. Okay, so for wound healing, there'd be infection. Okay, so this happens. This is the ultimate result. So before you go to the if you don't want to go to the amputation, so we have to prevent this from happening. So how to? So we have to prevent. So to prevent what? All the triggers. So the number one trigger for this would be anything that can cause vasoconstriction. So for patients with Buerger's disease, so you have your cause, right? You have the number one cause would be smoking. Then this is the number one priority when patient is in the hospital. So we have to do instruct them, for smoking cessation. They have to stop smoking. Okay. Then one of the triggers would be cold environment, for both, for Buergers and your Raynauds. One of the triggers would be cold environment. So exposure. The triggers would be anything that can cause vasoconstriction. So vasoconstriction is not our friend when it comes to your Buergers and your Raynauds. So anything cold, so is a no-no for this patient. Anything cold is a no-no for this patient. Same, the both of them. So this cold is a no-no. Okay, so we have to regulate the environment. For example, if you have a very cold room, okay, so we have to decrease or reduce the temperature, so it would not cause a trigger. So regulate the temperature, so not cold. Okay, so not cold. So if you're gonna choose from a if you're gonna choose from a warm compress, if you're gonna choose from one warm compress, or you have to submerge. Okay, you have to submerge. Okay, submerge to a warm water. Okay, which one would you choose? Okay, which one would you choose? So okay, the perfect answer would be submerge. Okay, you have to submerge, okay, in a warm water, not hot water, not hot water. So these are our one of our nursing teaching and education. So they have to wear gloves all the times when they go out of the house, especially if it's the season, like a winter season or anything that is, if the temperature is low, they need to wear their gloves. Okay, they need to wear gloves. Okay, so they need to wear gloves. So to protect their hands from vasoconstriction. Never wear anything tight when it comes to their footwear. Okay, when it comes to footwear, this is also a prevention from pain when you teach them how to prevent pain. And use a warm socks. Okay, warm socks. So anything cold here is our enemy. Okay, anything cold is our enemy. So this is a no-no. Anything cold is our enemy. Okay, anything cold. So again, what other triggers that we should avoid? Okay, so anything meds, no, medications. Okay, medications that causes vasoconstriction. Okay, anything meds that causes vasoconstriction. So no. Okay, this is a no. If they're out of the hospital, they might have used a party drugs. Okay, so you have to educate them. No party drugs, like anything that it can increase their heart rate, like meths, your methamphetamine hydrochloride, your ecstasy, anything that can increase the patient's heart rate causes vasoconstriction. Okay, so meths, ecstasy, these are some medications. So these are for party drugs, right? So medications that are given to you in the ER. So you have to stress that you have a history of Buergers or Raynaud's disease. Okay, you have to stress it because you might be given vasoconstrictors, like you might be given like theophylline, might be given aminophylline. These are medications can increase your heart rate. You might be given vasopressors, Okay, we've given vasopressors. So that will be technically be a problem for patients with Raynaud's and Buergers. Okay, so the goal here again is to prevent pain. Okay, so we can give them NSAIDs for pain. So ibuprofen. Okay, we can give them naproxen. We can give them indomethacin. Okay, so we the goal is also to reduce. Okay, so reduce pain. So we give them medications for pain like your NSAIDs. Okay, NSAIDs. Okay, naproxen. Okay, we have ibuprofen. Can give them indomethacin. This is good for inflammation. This is anti-inflammatory. So this is usually given for arthritis. This medication, indomethacin. So that's why colchicine is also given. Colchicine is given for patients with endocarditis. This is colchicine is very good with that. So colchicine. Okay, so as a painkiller, as a anti-inflammatory, so colchicine is also given. As a anti-inflammatory. So as anti-inflammatory. So we give them like if the problem is vasoconstriction, we give them dilators. We give them vasodilators. The dilator or the vasodilator of choice, because you have to reverse it. Okay, we can give them vasodilators, right? So vasodilators to reverse. So we have to reverse. So we give them this. So we give them iloprost. This is one of the most common medication for patients with Buergers and with Raynaud's. If you've heard of sildenafil, sildenafil is your Viagra. So this is your Viagra. So we can give them these medications. So again, if giving vasodilators, you have to watch for orthostatic hypotension. So always instruct to do a position change slowly, so to prevent orthostatic hypotension, prevent them from having an injury like fall. So always remember, okay, the goal here for patients with Buergers and Raynaud's is again to prevent the low perfusion. So anything vasoconstriction, constriction, okay, is our enemy. So this is our enemy. So meaning no to vasoconstriction. So no to vasoconstriction. So no to vasoconstriction. So we always remember that. We protect the limbs, we protect the hands, protect the feet, protect the fingers and toes. So the worst thing that can happen here, you see these things, is you have your gangrene already. You have like a foul smell. This is worst. You have foul smell. So again, you report this to your healthcare provider as soon as possible. So it's a foul smell. Okay, there's infection already. So we really have to advise patient, if they have this, they should have a good hand and foot care. So we should emphasize, because of they are at risk for infection, at risk. So they have to have a good hand and foot care okay. So compression stockings can help. It can help from stasis, no? It keeps our the blood moving, so we can advise to put on the compression stockings. Okay, this facilitates movement of the blood. Movement of the blood. This facilitates movement of the blood.